When a patient comes to see me with a problem of arthritis in the joint, the first thing you want to do is put the patient at ease, because you have a problem that's relatively elective. You don't have an urgent problem where we have to rush you to surgery. We want to educate you about your problem. There may be different approaches that we can take that are non-operative. And whenever we discuss operative care for arthritis of your knee or hip, we leave the decision of surgery up to you. My role is to educate you on what's involved in terms of surgery. I'll always start talking about risks before benefits. I want a patient to know that if you're going to go to surgery, that this is a very major step for you, and we want you to understand the procedure very well. Once you understand the risks, then we'll talk about the benefits that this surgery will give you. And if you're an average patient with joint replacement surgery, this will be a very good experience for you, and it will change your life.
Dr. Forster has done 2 complete knee replacement surgeries. My quality of life since my surgeries has increased tremendously. I'm an avid golfer. I play 3 to 4 times a week. I have no physical limitations when it comes to my knees.
I've been a physician at the Orthopedic Institute of Dayton for over 20 years, predominantly doing hip and knee surgeries. And I do over about 500 joint replacements a year, so I'm doing it every day. We've developed a team in surgery, so I have the same staff each day helping me, so we've become proficient at that. And I work at a hospital where there's a floor dedicated to joint replacement surgeries.
I have chosen Dr. Forster to do all of my surgeries. After the first one, beside his bedside manner and his thoroughness, the rehab was excellent. The outcomes were great. I was back to work in 2 months. I went back to him, obviously, when I had to have my next knee done, and then I had a hip done 4 years ago due to a lot of pain in that hip and arthritis. Having been a registered nurse for 40 years, I think I'm a pretty good judge of, and I'm very particular with, the physician that I would choose, and Dr. Forster is excellent with his post-op care, the rehab, the surgery itself, and the aftercare.
Another nice feature about this office and Dr. Forster's group is that they have physical therapy right here in the office. So you can, when you see the doctor, you can schedule your physical therapy at the same time.
Whenever a therapist has a question about any of your patients, they'll frequently walk over and ask us those questions, so we can impact patient care immediately. As a fellowship-trained orthopedic surgeon, you show that you have an interest in a certain area of orthopedics, and if we want to become an expert at that area, we'll spend an additional year in training doing nothing but that particular area. In my instance, I was very interested in my residency in joint replacement surgery.
I chose Dr. Forster because of his fellowship training, and that put him head and shoulders above some of the others that I had considered. My meniscus, which is that plastic-like pad between the 2 bones, half of it was worn away, and so it was bone rubbing on bone, and that's what hurt. That's what made my knee ache. And so eventually I had to get to have it replaced.
I have recommended Dr. Forster to 12 to 15 people, some of my golfing buddies, and they have experienced the same success with their surgeries as I have with Dr. Forster.
I would recommend Dr. Forster to family and friends, and I have on numerous occasions.
I would sure recommend Dr. Forster to do the work because he did such a professional job for me.